It's hard to believe that behind these soothing notes, professional musician Sandi-Jo Malmon is in pain, a pain that was diagnosed 14 years ago as arthritis in her knees.
I started having pain in both knees, actually. And the reason that that was obvious to me is because I'm a cellist. And you're sitting at the cello in a forward position so that your legs are apart, but you're bent.
Many parts of her life became more difficult over time. Traveling, sleeping, even just walking.
I was walking with a cane, and that limits everything. I have a lot of years ahead of me. I want to be able to do things,
Sandi-Jo would become one of the 600,000 people in the U.S. to need a knee replacement surgery.
There's an enlarging group of people that are kind of hitting that 60 to 70-year-old range. We are seeing a predicted significant increase in the number of people in America that have arthritis that has gotten severe to the point that they would potentially meet indications for surgery. That we're going to clean that out.
In a Massachusetts first, Dr. Jeff Zarin will try an innovative type of full knee replacement surgery on Sandi-Jo. He'll use Mako robotic arm-assisted technology to allow the new joint to be placed with a new level of accuracy.
There are a variety of robotic-assisted technologies currently available to assist with how we do joint replacement. But the Mako itself represents an evolution, an emerging of several technologies in a way we haven't really had before, in that it is basically a robot arm that kind of holds the instrument along with me in the operating room, so it helps me perform the surgery very accurately. The robot has a little tracking eyes that see where the leg is in space. So if the leg moves, the robot knows that. Even if it moves a tiny little bit, the robot knows it moved a tiny little bit, and it will adjust for that. It will know where we are in space relative to the...
Not only is the robot precise, but prior to surgery, a scan of the patient's knee is taken to create a virtual model of the specific patient's joint.
It creates this 3D representation of the patient's knee or hip, and then we can, before we even do the surgery, virtually put the implants in place as to where they would be. All that stuff can be done on the front end virtually, and then once we're satisfied with how things line up and look like they're going to be, then the robot helps me very precisely implement that plan and do the surgery for the patient, specifically exactly to those criteria.
I just thought, everything keeps going, right? We keep learning about new technology, and if there's something that is going to be that precise, I want to be part of that.
Sandi-Jo's procedure went well, and she's on her road to recovery. And she notes a hope for the future.
I'd like to be able to just sort of do regular activities without pain. I feel like what happens is I'll do something, and then I have to lie down and put my leg up, and that's been going on for a really long time. And I'm tired. I'm tired of that. I want a new scenario, I want a new challenge,